The World Health Organization says more than 20 million people in Yemen are in need of urgent assistance 8 years into a civil war. Two-thirds of the population rely on humanitarian aid. WHO says the healthcare system is struggling with only 54% of facilities fully functional. It's urging international partners to do more to provide humanitarian aid. Well, joining us now on the News Hour is Ferima Zerbo, who's acting representative and nutrition team leader for Yemen at WHO. She's joining us live from Yemen's capital, Sana'a. Thank you so much for your time. Can you paint us a picture of the situation first? The health system across Yemen, 8 years into the civil war. What challenges is it facing?
9 years after the start of the conflict in Yemen, two-thirds of the population is in humanitarian assistance needs, which is nearly 22 million. 20 million of those people are in need of healthcare assistance. This is a health crisis within the humanitarian crisis. This crisis is accelerated by conflict, mass internal displacements, Yemen deteriorated economic situation, as well as recurring natural disasters,
right,
which are worsening the situation.
Right. So there is a war, of course, as you say, but also the COVID pandemic, a cholera outbreak. Tell us a bit more how the health system has been impacted, healthcare workers, people's lives. How are they able to cope with all these issues?
The health system has been impacted. Based on evidence, currently only 54% of health facilities are fully functional in Yemen. And the 46 remaining are partially or not functioning at all. And those who are still open in Yemen, they are struggling to deliver basic health services due to health staff shortages, as you said, medicine shortages, supplies and equipment shortages. So Yemen health situation is in a need of improvement, a huge need of improvement.
And so what's WHO been doing? What's been WHO's response? How are you trying to improve things on the ground?
WHO has been supporting the government with many other health, international or local partners in sustaining the health system in Yemen, to make sure that the most vulnerable population will be accessing the basic health services. We are, as you know, we are in the response to acute food insecurity leading to acute malnutrition for more than 1 million children. WHO have therapeutic feeding centers, which have been since 3 or 4 years, saving the lives of more than 70,000 children in Yemen.
Okay.
Providing.
So what is your message to the international community, briefly?
I beg your pardon?
What is your message today to the international community?
My message to the international community is to continue supporting what has been already built in Yemen, to strengthen the needed health services, to be able to provide to more than 2.9 million people in Yemen the healthcare they are in dire need and they have been seeking for. WHO needs 392 million USD with health actors to support this system, to make accessible to Yemen population the health needs toward the reaching of the Sustainable Development Goal.
Okay, thank you so much for taking the time to speak to us. Ferima Coulibaly Zerbo from the WHO joining us there live from Sana'a. Thank you.